Hello everyone.
Hello.
My name is Amanda Settles, and today I will be giving a class on neonatal abstinence syndrome. So who's known anybody that was a drug abuser or that has been addicted to drugs? Yes, most of us here. Because drug addiction does not see age or color. Okay? It can affect everyone from the wealthy to the poor, the young and the old, black or white. But what's heartbreaking is that newborn babies who did not make a conscious choice to abuse drugs can be born addicted to drugs. Okay? Every 25 minutes, a baby is born suffering from an opioid withdrawal. Every 25 minutes. And let's talk about what this neonatal abstinence syndrome, or NAS, is. It is a group of problems that occur in a newborn who was exposed to addictive opiate drugs while in the mother's womb. The cause. When a woman uses drugs while she's pregnant, the drugs will then pass through the placenta that connects the baby into the mother in the womb. As a result, the mother and the baby both become addicted. Between 2000 and 2009, the number of mothers found to be using opioids during a pregnancy increased from 1.19 to 5.63 per 1,000 U.S. births. U.S. births. This is happening in our neighborhoods. In the same time period, NAS diagnosis increased from 1.20 to 3.36 per 1,000 hospital births. These are the addictive drugs that can cause NAS. Heroin, codeine, oxycodone, methadone. Methadone is similar to morphine, but it can have a longer effect. What's really scary about methadone is that they use this drug to overcome opioid addiction, and then they become addicted to this. Buprenorphine, that is another medicine used for detox. Alcohol. Benzodiazepine is like a Valium, treating for anxiety, depression, or even muscle relaxers. And barbiturates. It is a sleep-inducing drug. And certain antidepressants can also have an effect on the newborn baby. Now, mothers who use nicotine or marijuana can also have long-term problems, but there's no evidence that it can actually cause withdrawal symptoms. What are some of the withdrawal symptoms? All of the above: the blotchy skin, the excessive or the high-pitched crying. They can have fevers, poor feeding, sweatiness, irritability, seizures, hyperactive reflexes. They can have diarrhea, excessive sucking, rapid breathing, sleep problems, slow weight gain, stuffy nose, tremors, and vomiting. These are all of the withdrawal symptoms that the mother can also experience as well. Another possible complication that they can have is the birth defects. Low birth weight, less than 5 pounds, premature death, and a small head circumference, SIDS, and problems with developmental and behavior. All of these are going to depend on how long the mother has used the drugs, or how much drugs she was actually taking, and how long she actually used the drugs. It can start from 1 to 3 days of birth, but with a lot of TLC, or tender loving care, they will be nursed back to health. Here are some statistics. NAS increased nearly 5-fold across the country over the past decade, and 1 out of every 10 children are born dependent on heroin or some other opiates. Now we're hearing about heroin because there was a Protecting Our Infants Act that was signed by President Barack Obama in 2015. Yes, the bill helped eliminate a lot of the pill overdose, but heroin was still in the streets and very easily accessible. So yes, they did a great job with the pill, But a lot of these mothers are just avoid withdrawal, finding heroin, just so they can function throughout the day. And this is why this is such a huge epidemic that requires immediate attention. And it starts with us in our neighborhoods. Thank you very much. This was my class.